My name is Jenna Mielke, and I'm a physical therapist at Body Mechanics Physical Therapy. I specialize in women's health and orthopedic conditions. As physical therapists, we are movement specialists, and we work on dysfunction of both muscles and joints. Our pelvic floor itself consists of a group of muscles that control sexual function, bowel, and bladder. So even though it may not seem intuitive that physical therapists would be the ones that work on these types of conditions, because our pelvic floor consists of muscles, it makes a whole lot of sense that we can be the ones to help patients with these types of symptoms. There are a wide variety of symptoms that we can address, but the most common are urinary leakage, urinary urgency, pain during intercourse, and pelvic pressure, also known as pelvic organ prolapse. We can also work with women during pregnancy for a variety of the pain-related symptoms that they may be experiencing, and just know that it's normal to have more than one of these symptoms at the same time. We can also work on orthopedic conditions such as low back pain, and those things actually may be stemming more from our pelvic floor than we realize, so those are all fair game for women's health physical therapists. I think the answer to this question relates back to the concept of why would I see a physical therapist for problems related to my pelvic floor? I really enjoy being able to help women work on symptoms that can be uncomfortable to talk about and create an open and safe environment to address problems that really affect our quality of life. My goal is to make this be more normal and a routine care, and for someone to realize that just because they had a baby doesn't mean it's normal to pee when they laugh or when they work out or have problems with sexual function, and that there's something that we can do about it to address. Here at Body Mechanics, all physical therapists treat in private treatment rooms, and you can expect one-on-one care with the same physical therapist throughout your entire plan of care, regardless of what you're being seen for. As the women's health provider, what I will start with is a comprehensive evaluation from a total body approach, as there can be a lot of different factors that could be contributing to your symptoms. Typically, I do include a brief internal examination as it helps give me more information, but this is 100% the patient's choice, so if this is not something you're comfortable with, there's still a lot that we can look at. One thing that I hear really often from patients is that they already do Kegel exercises and they don't seem to help. I think there's a few things that are important to know about Kegel exercises, one being that a lot of times they're not performed correctly, and oftentimes doing them may actually worsen your symptoms if they're not appropriate for you and what you might have going on with your body. Although Kegel exercises can be really vital to our pelvic floor function, there's a lot more that goes on from a comprehensive pelvic floor mobility and strength aspect that we can address. From a statistic side of things, our data shows is that only 49% of women with verbal instruction alone perform these exercises correctly, and 25% of those that are doing these exercises are contracting in a manner that are actually worsening their symptoms. The other thing that I hear really often is that urinary leakage and urgency are both normal things that happen because of age and because of postpartum. What I want you to know is that these are not normal, and there's so much that we can do to help address and improve these symptoms to improve your quality of life.